Hey y'all, this is Shanti coming to you with another video here on my channel with ShantiJaySpeaks. Today we're going to talk about the factors that tie into having an ectopic pregnancy, or what can cause an ectopic pregnancy. And we're just going to dive right into it. So the first is having an infection or some inflammation in the reproductive area. This can be caused from pelvic inflammatory disease, or this can be caused by previous STDs such as gonorrhea and chlamydia. Some people have issues with endometriosis and things like that also can cause some inflammation in the area. The biggest thing is inflammation. Inflammation can, put scar tissue in the fallopian tubes. Inflammation can also cause mucus to be in the fallopian tubes. And those STDs that I mentioned, gonorrhea and chlamydia, if you have had those in the past, those also can cause you to have an ectopic pregnancy as well, because of the scar tissue that builds up from that STD. Other, symptoms and things like that is if you had like a previous surgery, or if you had like a previous fallopian tube repair. So if you had surgery in your reproductive area, you can get scar tissue from any surgery. So if you have surgery in your reproductive area, however, that scar tissue can cause you to have blockages in your fallopian tubes, and it can cause you to have an ectopic pregnancy going forward. If you have had a previous ectopic pregnancy in which they were able to save the tube, or they were able to repair the tube, this can cause some scar tissue still with that tubing. And for my situation, they told me that my tube could not be repaired, and if they would repair it, then I would probably end up with another ectopic pregnancy due to the scar tissue that will build from them trying to repair a tube that already has scar tissue in it and blockages in it. So they didn't want to go through and repair the fallopian tube because, one, it had already ruptured from the baby being there for so long, and the baby had grew to be very, very big. In my last video that I posted, I did show the ectopic pictures that they took when they were doing the surgery of what the fallopian tube looked like with the baby inside, and what the fallopian tube looked like after it was removed and the baby was removed as well. So I suggest just going back to look at that video. I named it the signs of an ectopic pregnancy. Other things that may cause you to have an ectopic pregnancy is if you had a D&C in the past. And this is basically when they go in and they basically scrape out anything that was previously there. They do this when you've had a miscarriage and the baby was actually, farther along in weeks. They do this with abortions as well, depending on how far you are along with that as well. But if you have had a D&C, it can cause scar tissue. And this scar tissue can cause you to have an ectopic pregnancy later on down the line if it's not managed carefully. If you don't know that it's scar tissue there, you can still have an ectopic pregnancy even after the D&C was performed. Let's see. Another condition is endometriosis. And endometriosis is basically like the normal lining of the inside of the uterus is basically somewhere outside of the uterus, and it just causes just inflammation, and it's basically a diagnosis with the endometrium, and that the endometrium is supposed to be inside, and that's the inside of the lining of the uterus. For some reason, it's the lining of the endometrium that's found outside of the uterus, and this can also cause blockages in your fallopian tubes as well. So if you have endometriosis, it is advised that you see a fertility doctor so that they can treat the endometriosis. They will more than likely do a biopsy of the endometrium lining, and they will send it to a lab for them to test for hyperplasia or chronic endometriosis. Either way, it's good to know that you have endometriosis so that it can be taken care of with a fertility doctor. OB-GYNs probably do something with this, but I would much rather deal with a fertility doctor when it comes to endometriosis or anything with the uterine walls or endometrium or anything like that. Abnormal shape of your fallopian tubes. So we are born with a set of fallopian tubes, and depending on what shape those are in, that can cause you to have an ectopic pregnancy. So let's just say your tube is not straight, or like that. It's more so like a sharp V, or maybe it's like this, or maybe it's really crinkly, and so for that embryo to bounce through there, it'll become difficult for the embryo to get through because there's so many twists and turns and crooks and bends in your fallopian tubes. And if your fallopian tube is just an abnormal shape, and this can happen when you're born, then you can have an ectopic pregnancy and not even know that your fallopian tubes are, not the shape they're supposed to be until you end up with an ectopic pregnancy. The highest factor for the pelvic inflammatory disease, for the fallopian tubes being blocked or for an ectopic pregnancy is pelvic inflammatory disease. Pelvic inflammatory disease is just basically inflammation of the pelvic area. And we need our pelvic area in order to have a healthy and successful pregnancy. Because the inflammation is there, it can cause some blockages, it can cause mucus to be built up, and it can cause that embryo that was just fertilized by the sperm to be blocked and not get to the uterus the way it's supposed to. If you have had a previous ectopic, so in my case, I've had a previous ectopic pregnancy in the past, they will monitor me more closely because it's 9 times out of 10 a higher risk for me going back into trying to conceive, because I would be at high risk for another ectopic pregnancy, seeing that I already had one. They don't necessarily know why this is, but they can guarantee that if one side is like that, then the other side probably has some damages too. So I'm going to a fertility doctor so that they can do, it's HSG, and what they're going to do is put some contrast dye inside to see if my fallopian tube, the other one that I have left, is blocked. If it is not blocked, then I can try naturally once more. But if it is blocked, I will have to go further in my fertility journey when it comes to possible IVF and things like that to bypass the fallopian tube altogether. And even with that, the retrograde embryo migration, if I was to have an embryo implanted, that's still a possibility that I can have a retrograde embryo migration simply because I previously had an ectopic pregnancy before. The hope is that since they are going to bypass the fallopian tube, and if that tube is considered blocked, that the embryo can go back in there anyway because it's blocked and it won't allow it to go back in. But that's just the hope. If you've had infertility problems, and I know I said I was not going to say infertility on this channel, but just for the sake of right now, if you have had fertility issues, if you've been infertile, if you've been taking medications, if you've been trying to track your cycle, if you've had abnormal periods and things like that, and you just can't get on a cycle for you to get pregnant and conceive, this can be a factor in you having an ectopic pregnancy in the future. So it's very, very, very important that you go to a fertility doctor to seek help with your fertility issues, so that they can make sure that they monitor you closely, so that if an ectopic pregnancy does come about, they'll be the first to identify it and know what it looks like and know how to save your life from it, honestly. And I would rather go to the best doctor known for this, and that's basically the fertility doctors, because they specialize in the reproductive system. OB-GYNs, they specialize in the baby development and the gynecological health of a woman. But to know the ins and outs of like certain diseases such as endometriosis, PCOS, and things like that, I would much rather go to a fertility doctor because they specialize in that. If that makes sense. Oh, if you have medication that stimulates your ovulation, this can cause you to have an ectopic pregnancy as well because of the hyperstimulation of all of the medications. So the medications can cause you to have an ectopic pregnancy going forward, just because your body is being pumped with extra hormones, extra, with the shots and everything. Your body's being pumped to ovulate and being forced to ovulate. And usually if you're not a person that ovulates, or if you're having trouble with ovulation and you have to take medication to help you ovulate, factor that can cause you to have an ectopic pregnancy. Now, none of these are definite. I'm not saying that if you have any of these things that you are definitely going to have an ectopic pregnancy. No, that's not what I'm saying. I'm saying that it's a possibility that with these factors, that this is prone to promote an ectopic pregnancy going forward. And it may or may not happen, but it's just good to just know these factors that tie into it. Okay? My friends that have IUDs, so because the IUD goes into the uterus and it spreads like that in the uterus, the egg still may get fertilized from sperm somehow, and it will go through the fallopian tube, but because it's not able to get in the uterus because of the IUD, now the egg is gonna continue to grow regardless. So that egg is gonna continue to grow wherever it decides to plant itself. So if it can't get into the uterus where it's supposed to get to implant, then it's gonna implant somewhere else, and it's gonna start growing somewhere else. So if you have an IUD in place, be careful with the IUD. You know, when you have sex and everything like that, you know, make sure your IUD is in the right place. Make sure that it's not like lost somewhere. Make sure that you get your annual checkups or your 6-month checkups to just have your doctor check to make sure the IUD is in the right place. Even if it's in the right place, there's still a chance that because you have an IUD in, that you can have an ectopic pregnancy. So I do want to stress that. I guess it's my personal opinion. Seeing that I was on birth control before, I do feel like the birth control may have contributed to the fact of my fallopian tubes being black. I don't know if it was just the scar tissue of my body trying to, you know, produce an egg, and then the medicine telling my body not to produce it, and just that friction of going back and forth. I do personally feel that certain birth controls will cause you to have an ectopic pregnancy as well. We will be looking more into that. I hope they do some more studies about it to find out what birth control has on the long-term effects of a woman and her fallopian tubes and her ovarian reserve and all of that stuff. I will just hope that they come out with some more studies regarding that, because I'll be fascinated and interested to see what they say, and I read all of the articles anyway, so it'll just be interesting to see if they relate birth control to infertility issues going forward. I do want to talk about the chances of pregnancy with the ectopic pregnancy as well. And I mean, for me, they told me my chances are a little bit lower, but I still have a good chance of conceiving and having a natural pregnancy if my other tube is not blocked. If my other tube is blocked, I still stand a chance of having a very good, successful pregnancy going forward. And even though my chances are a little bit less because I have one tube, it doesn't stop the fact that I can get pregnant. It doesn't stop the fact that I can conceive. It doesn't stop any of that. So going forward, I'm just hoping that I don't have a blocked tube on the other side, and that I can go into it one more time naturally. I'm supposed to see a fertility doctor soon, so I will be taking you guys into that appointment with me so that you can just hear some of the things that is being said about just generalized pregnancy and just the ectopic pregnancy that I experienced. With one tube being removed, I have a 40% chance of having a successful pregnancy. And so this knocks it down tremendously, and it's only because I have one tube. So if you have both of your tubes, let's say that you had an ectopic pregnancy and you were given methotrexate at an earlier time in your pregnancy, and you were able to save that tube, and the methotrexate basically stopped the growth development of the cells of the baby, and you were able to save your tube, then your chances still would be higher, even though there's still a chance of you having another ectopic pregnancy in that tube again. Chances are that you have a better chance because you still have both of your fallopian tubes versus having one, like for me. I'm still hopeful though, and I still pray and I still believe in God for what he's about to do. And on this channel, I just want to show God's glory whenever he does decide to bless us with a child and a successful pregnancy. So chances of an ectopic pregnancy increases if you had an ectopic pregnancy before. It increases about 12%. And so even though this doesn't seem like much, it is a huge factor, considering that well, for me, I'll talk just for myself, considering that I have one tube and I have a 40% chance of a successful pregnancy, and considering that I had an ectopic pregnancy in the past at 12%, that's a pretty high chance versus what it was at first. At first, they said it was only a 2% chance that any woman that is pregnant can have an ectopic pregnancy. Now, because I've had an ectopic pregnancy, that went up 10 points. And now I'm at a 12% chance of risking to have another ectopic pregnancy again. So I just have to be very careful. My doctors will just have to monitor me very, very closely just to make sure that I'm okay and don't have an ectopic pregnancy going forward. Whew. So if a woman can conceive, she can have an ectopic pregnancy. If you can conceive, whether it's naturally or whether you need help from a doctor, if you conceive, there is a chance that you can still have an ectopic pregnancy. I know, it sucks. But if you're doing it at home naturally and you get a positive pregnancy test, it's okay to be excited. As we say at the fertility clinic, we want our patients to be cautiously optimistic, which means be excited, be happy, be joyful, but just be cautious about that, because it can go either way. And even with a pregnancy, a natural pregnancy, it can go either way. I've have some friends that have, gotten pregnant and they've carried the baby all the way to their 9 months, and then they birthed a stillborn baby. Or I've had, family and friends that were pregnant and they were well along in their second trimester and end up, having a miscarriage, or the baby's heartbeat stops and everything like that, which is very dramatic and it's very heartbreaking. And these were naturally conceived. So even if we get help through a fertility doctor, because of the natural risk, those natural risks are on top of our risk of fertility as well. So we stand the risk of having an ectopic pregnancy. It's something that is not really spoken about because people don't want to think about, an ectopic pregnancy, when they're pregnant. But it's so life-threatening that you have to consider all odds. You have to consider everything when trying to conceive, when trying to have a baby, when trying to bring a child into this world. We don't want our lives to be in jeopardy by trying to bring a child into this world, because we want to be here with the child. And so with that being said, just take care of your body. Have your vitamins at hand. Take your vitamins. Try to eat a healthier diet. Stop smoking. If you are smoking, stop smoking, because this can cause you to have blockages in your fallopian tubes. This can cause infertility. This can cause major problems with hormones and ovarian reserve and all of this stuff. If you have smoking in your habits, I suggest, if you're trying to conceive and if you want a baby in the future, that you stop smoking right now. Right now. If you have a cigarette while you're watching this video, put it out. Stop it right now, even if you have to go cold turkey. Why? If you want a baby and you want it bad enough, and you want your uterus to have a habitat where your baby can grow healthy, stop the smoking. Put it to the side. It's not something that, if you just have to have it, it's not something that you can come back to. But you wouldn't want to come back to that, because then after you get pregnant, you wouldn't want to smoke while you're pregnant, and then after you have the baby, you won't want to even have your clothes smelling like smoke, because your baby has to inhale that secondhand and third-hand smoke. So just altogether, just stop it. Just stop the smoking, because it is literally linked to infertility in so many ways. It is literally linked to our fertility world in so many ways, and we don't even recognize it. And this is not just cigarettes. This is marijuana too. So if you are smoking marijuana, if you are smoking cigarettes, if you are smoking cigars, Black and Milds, all of that, smoke, period. The tobacco, period, is not good for you. If you say, oh, I don't know, smoke papers or something like that, it's natural. It's not natural as far as you trying to conceive. Any smoke will shrivel up those fallopian tubes. It will make things inside become old fast. And even on the outer appearance of things, you'll begin to look like an old lady. Let's just be honest. I'm sorry if I offended some of my smoking subscribers, but you too, if you're watching this, for your health, for your lungs, for everything else, just stop smoking. Even if you're not trying to conceive and you're watching this video with somebody else that's trying to conceive, but you smoke, and they're trying to conceive, you being around them and letting them smell that on you, it's not healthy for them. So if you want to help somebody and you want to help yourself, stop smoking. Okay? Please, 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 please. I know it's harder said than done, but one day at a time goes a long way. And before you know it, it takes 21 days to break a habit. So if you can go 21 days without it, I know it seems like a lot, but if you can go 21 days without it, you have broke that habit. And the only way you'll go back to it is if you want to go back to it. Drink your water. A lot of times we're not drinking enough water. We're not even hydrating our organs inside. We're not even hydrating our fallopian tubes and hydrating our uterus. We're so dehydrated at times, and we expect so much from our bodies, and we have to do better, y'all. We got to eat right. We got to, you know, take our vitamins. We got to drink our water. We got to stop all the habits that are not good for us. And stress. Stop the stress. If you can stop the stress, that's less on your body, less stress on your mind. Even if you're stressing about conceiving, don't stress about conceiving. I say this all the time in my videos. Don't stress about conceiving, because if you stress about conceiving, you may not conceive because your body's so stressed out that it's not going to be a good habitat for the baby to grow and develop. So that's pretty much all I have for you today. And I just want to say, you know, just continue to like take care of yourself. At the end of the day, we can only take care of ourselves. We can, you know, have our husbands, you know, do things for us, but as far as us taking care of our own bodies, that's our job. So my next video, I'm going to strictly probably be talking about vitamins, because I do want to go over the vitamins in more detail and what they do, and the antioxidants and anti-inflammatory vitamins that are out there. So I will more than likely probably be making that within the next couple of videos, if not the next video. So until next time, guys, take care of yourself, take care of each other, love on each other, love on family and friends, and take care of your body, take care of your mind, take care of your spirit. And with this, just remember, we can't conceive without God. We can't do it without God. And it's on His timing, not ours. So now that you know the factors, don't forget to like, share, and subscribe. Hit that like button, and on the, I think it's on the right side of your screen, it's the red subscribe button. And go ahead and hit that subscribe button for me, so that you can get every video going forward regarding issues with fertility and conceiving, baby videos, and anything that I decide to do that's fun. So until next time, guys, I will see ya. Ciao.